Now, when you become a late retiree, that's really defined as anybody who takes Medicare A, B, or both post age 65. And if you end up taking Part B or A and B as a late retiree, it's usually because you've had large group employer coverage that was better for you or your needs or situation. Generally, what we try to do is time your A and B enrollment as a late retiree to begin the day your old employer coverage is going to end. So for instance, if you were going to be retiring on January 1st, 2027, we would want to time your coverage ending December 31st, 2027 with employer and line up everything for A, B, and additional coverage for January 1st. And we can help you with the timelines on that and the forms to complete for a special enrollment period as a late retiree. So the first step is figuring out, hey, I'm turning 65. Do I have to sign up for Medicare? Everybody tells us we do, and it can become a real panic button in terms of making sure you don't make a mistake or miss any important deadlines. The decision of whether or not you take Medicare is individual based on your current needs and situation. When you sign up for Medicare, it really comes down to whether or not Medicare is going to be considered primary or first. If you are on an individual plan, subsidized or not by Covered California or by Marketplace, if you are on COBRA and become eligible for Medicare, if you're on a family plan, maybe just you and a spouse and a child, not through your employer, if you're on Medicaid, which is the national program for low income, known in California as Medi-Cal, then you must take your Medicare A and B during your initial enrollment period. If you don't, and you are under one of these circumstances, you could face delays or penalties later on. That means enrolling during your initial enrollment period, the 7-month window surrounding your 65th birthday. Now, when you have group coverage, this is often one of the biggest questions we address. Well, I have coverage through work. Do I have to sign up for Medicare? And the short answer to that is it depends. When you're turning 65 and you're still working, or if you're turning 65 and your spouse is still working and covering you as a dependent on their plan, there are frequently options for you to remain on that coverage. And what the rules are going to vary based on the size of that employer. Now, whether or not you have the option to remain on the group plan, an assessment is still needed because it's possible that leaving the group plan could still be financially beneficial to you based on cost and coverage. So it's something you should still look at no matter what. When you turn 65, if your employer or your spouse's employer, where you're covered as a dependent, has employees of more than 20 on the plan, by law, they must keep you on that plan if you are still actively working or if you get the coverage through a spouse who is still actively working. Generally, these large group employer plans frequently have low cost and strong coverage. And if that's the case, delaying Medicare may very well make sense, and you'll be eligible for a special enrollment period down the road when you leave that employer, in which case you can take your Medicare with no delay or penalty within 8 months of losing that coverage. However, even if you're with a large group employer plan and they'll allow you to stay, if for some reason the cost and benefits of that plan don't work for you, becoming eligible for Medicare is a qualifying event, and you have the option to potentially leave that group if it's not beneficial for you. Things you'd want to consider is, do I cover dependents on that plan? What is the cost of that plan? What is the coverage of that plan? If your answers to those are positive or yes, then you may very well want to remain on that plan. If, however, it's just you and you're paying a high price and you're not satisfied with the benefits, opting out could very well be an option for you. Now, rules and laws have recently changed around employers that cover less than 20 employees. If the plan is willing to keep you on their plan, and that means the employer is willing to keep you on their plan, it's optional for them. So they can say, hey, you're turning 65 and we only have 18 employees on our plan and the cost is going to be expensive for you. We would like you to opt out and go on your Medicare. That's within their right to do that. They can also say, we'll offer you this small group plan, but you have to take your Medicare A and B as your primary insurance. Because on small group employer coverage, if you have Medicare, Medicare is primary or first. Or they can say you're free and welcome to remain on this small group plan, and you can take Part B later, just like large group late retirees, within 8 months of losing that coverage with no penalties or delays. Here's the deal though. Frequently, smaller employers tend to share much more of the cost with the employees, so you may be paying a significant portion for those benefits. You also might be paying a very high deductible and a high maximum out of pocket. So frequently, even if the employer is willing to keep you on the small group employer plan, often Medicare is a better proposition for you depending on your needs. Now, every case is different. You're going to want to look at, are you covering sons or daughters or spouses on the plan that are not yet eligible for Medicare? Is there a special benefits package that makes sense for you or your family that you need to take advantage of? Is the employer subsidizing all of that cost for you? And are the benefits rich in nature? If they are, you still may want to remain with that small group employer plan. However, the likelihood that you're sharing in much more of the cost is significantly greater on a small group plan. And once again, if it makes sense for you and your needs and situation, you may have the option to opt out. Now, it's common for people to take Medicare Part A, even if they're still working. Part A is the hospital portion of Medicare, which where as long as you've worked at 10 years or 40 quarters, you're entitled to premium-free Medicare Part A, and it would work as a secondary insurance to your large group employer plan and as a primary insurance for hospital coverage for a small group employer plan. However, there could be reasons to delay Medicare Part A as well. For instance, if you don't have in 10 years or 40 quarters and you pay a monthly premium for Medicare Part A, or if you're contributing to a health savings account at work, you can't keep contributing and take Medicare A. So you may want to delay for those reasons as well. So all of this is a good education for you of why having a pre-assessment with one of our agents is going to assist you in this process to say, let's take a look at what you have, what it looks like with Medicare, and what makes sense for your needs and timing. Now, when you become a late retiree, that's really defined as anybody who takes Medicare A, B, or both post age 65. And if you end up taking Part B or A and B as a late retiree, it's usually because you've had large group employer coverage that was better for you or your needs or situation. Generally, what we try to do is time your A and B enrollment as a late retiree to begin the day your old employer coverage is going to end. So for instance, if you were going to be retiring on January 1st, 2027, we would want to time your coverage ending December 31st, 2027 with employer and line up everything for A, B, and additional coverage for January 1st. And we can help you with the timelines on that and the forms to complete for a special enrollment period as a late retiree. Now, if you're contributing to a health savings account at work and you plan to stay on employer coverage, just note that you should not be contributing to an HSA and taking Medicare. So you have to be very careful about that. And if you take Part A as a late retiree, they will retroactive your Part A back 6 months. So they say stop contributing to an HSA about 6 months before planned retirement. Generally, the reason people will delay Part B when they have large group employer coverage is that coverage is working great for them and there's no reason to pay the additional cost for Medicare Part B. One thing that's really important to note that it's important once you're age 65 or older that you keep the documentation along the way of any employer coverage that you have to show you've always had continuous employer coverage so that you avoid delays in enrollment, you avoid penalties down the road. So really important to keep that paper trail in terms of your late retiree status. Now, the most common enrollment window that you're going to encounter when you're approaching Medicare eligibility and what A, B, C's, and D's are all about is this whole turning 65 concept. When you turn 65, you're approaching Medicare eligibility. So whether you're working or not, there is a decision to be made around your Medicare when you turn age 65. So let's say, for example, your birthday is January 15th, 1962. You're going to have an enrollment period that surrounds your birthday, 7 months, October, November, December, the month of January, February, March, and April. You'll see the example here. Your birthday is July 15th, 1961. That enrollment window opens April, May, June the month of July, August, September, October. That means you have a decision to make within that 7-month window about taking your A, B, or both. Now, if it turns out Medicare is going to be stronger for you, usually people are enrolling towards the beginning of their window to line things up at the first date of eligibility. Generally speaking, the first date of eligibility is the first of your birthday month. So in this example where your birthday is July 15th, you're actually eligible for Medicare as soon as July 1st of 2026. And in the example I gave of the January birthday, it would be 1/1/2027 is your initial eligibility date. Now, there can be a lot of variety in that based on timing, needs, and situation of how we want to set that up. But typically, you're making a decision around Medicare during that IEP. Now, every situation is different. That's why we do a pre-assessment. And if we determine that your group coverage is going to be stronger for you while you continue working, then we'll explain a special enrollment period for you down the road, which is called the SEP for late retirees. It gives you 8 months from the date of losing employer coverage to get your A, B, or both if you need it. And once again, we usually recommend about 2 months prior to the planned retirement date, getting your documentation together, submitting your enrollment, so that you're actually timing that coverage under a qualifying event for the day your other coverage is scheduled to end. And we can help you look at the questions you need to answer to make a good evaluation and decision on what to do. Now, one of the big things that people talk about is, I've been at a dinner party or I talked to my neighbor and they told me I'm going to get penalized if I don't sign up for Medicare. And the answer to that is yes, that's true if you don't have a qualifying reason to wait. So if you're on individual coverage or you have low income Medicaid or you're on an individual and family plan, Medicare is considered primary or first, and we can help you assess that. And you do need to take your A, B, or both during that initial enrollment window to avoid enrollment delays later on or penalties. So that's really, really important. If Medicare is primary, you need to take it during the 7-month window. However, if we have proof that you're going to have creditable coverage through a large group employer plan and you're going to continue with that coverage, it's completely justified to delay taking Medicare in that situation. You just want to confirm those details before your initial enrollment period ends, keep the proper documentation, and then enroll within your 8-month special enrollment period down the road and get your additional coverage at that point. Understanding the rules, understanding the penalties is critical. So part of that is learning through the Medicare 101, and then a big piece of that is learning through the pre-assessment process where we're here to help. Now, we're going to help you through that pre-assessment. We're going to ask you questions like what prescriptions you take, what doctors you see. We're going to have you sign something called a scope of appointment. We're going to find out if Medicare should be primary or first in your situation. We're going to ask you questions about your current coverage, like the cost, the coverage, and any dependents that you cover. And within that information, we're able to provide you with that important assessment that helps you determine exactly what you need to do during your initial window. If you have questions, you can always reach out to us at reservations@blackpointinsurance.com. We're here to support and assist you every step of the way.